Don't you hate it when you have to pee into a cup? There's a reason those tests are done. Hematuria is blood in the urine. Sometimes you can see it and sometimes it's invisible. Blood you can see is called gross hematuria, and blood that can only be seen under a microscope is called microscopic hematuria. A urinalysis is a urine test that's often done for diabetes, prostate problems, to look for infection, to help sort out kidney disease, and for other reasons. There are many causes of hematuria, and most of them are not serious. Picking out the causes that are serious makes all the difference. Blood you can see is usually more concerning. Hematuria can be caused by infections, kidney or bladder stones, kidney disease, periods, prostate enlargement in older men, anti-inflammatory medications, and even strenuous workouts. The causes that need to be excluded are cancers in the kidneys, bladder, and other parts of the urinary tract. Risk factors for cancers are smoking, prior radiation, chemotherapy, or environmental exposures. Age, gender, family history, exposure to chemicals, and having a catheter in for a long time are all risks. For low-risk patients, repeating a urinalysis in 6 months might be all that's needed. A CT scan or ultrasound might be needed, and referral to a urologist is often indicated for higher-risk patients. The urologist can look into your bladder with a camera on a thin tube. Don't worry, they'll use an anesthetic. Most people with blood in their urine do not have major problems, and for many, a cause is not found. Finding more serious conditions earlier can be life-saving. Talk to your healthcare provider. Helping you work through problems like this is why they spent all that time in school. And remember to call an elder. They've been waiting for your call. I'm Dr. Arne Vainio, and this is Health Matters.